Hello Mary, thank you for coming along this afternoon. I know that you have a key role in insulin pump therapy in NHS Tayside, and I have a list of questions here I would like to share with you this afternoon. One of the first things would be, why would someone with diabetes want to use an insulin pump?
In general, insulin pump therapy could be considered for someone with diabetes who is not achieving their goals. More specifically, if we're looking at specific reasons for insulin pump therapy, is perhaps if someone's having problems with hypoglycemia, especially if they've lost their warning signs of hypoglycemia or if they have altered warning signs of hypoglycemia. Another reason may be for pre-pregnancy. Women with type 1 diabetes considering pregnancy, insulin pump therapy has been shown to improve blood glucose levels and reduce variability in blood glucose levels. Another reason may be if someone has undertaken a carbohydrate counting course, is using basal bolus therapy, but is not achieving the blood glucose levels that they require. Another reason might be when patients are having problems with dawn phenomenon. Blood sugar levels are satisfactory overnight but rise early in the morning. Despite changing their basal rates, their basal insulin, they can have problems with hypoglycemia.
Mary, you mentioned reducing blood glucose variability with patients, and you also mentioned about different insulin levels and different blood glucose levels overnight. Do you ever use continuous blood glucose monitoring systems with patients who are using insulin pumps?
Yes, we do, Debbie. Recently, we were able to secure funding for one of our ladies with type 1 diabetes who was pregnant. She was able to use continuous glucose monitoring for the whole of her pregnancy. This lady came to the antenatal clinic on a 2-weekly basis where we downloaded the data from her pump. This data showed very little in the way of variability with her blood sugar levels and also minimal hypoglycemia, and she achieved very good HbA1c targets.
Very good, good. So what referral criteria does NHS Tayside have to guide insulin pump use?
Well, Debbie, our referral criteria has been based on NICE, which is the National Institute for Clinical Excellence, and SIGN, Scottish Intercollegiate Guidelines Network. To just bullet point these topics, it would be for pre-pregnancy, if someone is having problems achieving good glycemic control despite being on a basal bolus regime and carbohydrate counting, patients having problems with hypoglycemia, specifically hypoglycemia, loss of hypoglycemia awareness or impaired hypoglycemia awareness. Okay.
And which patients would not be suitable for insulin pump therapy?
Patients with type 2 diabetes, perhaps some patients who have mental health problems, those patients who are not motivated or unwilling to monitor their blood sugars at least 4 to 6 times a day, carbohydrate count and adjust their insulin doses accordingly. Also possibly patients who are visually impaired.
Okay. And for those people who are using an insulin pump, are there times when insulin pump therapy is not suitable for them?
Yes, I would think, well, for an example, if perhaps someone's being admitted to hospital for surgery, they have to undergo a general anaesthetic, so the patient would have to be competent and able to use their pump.
So when safety is an issue,
yes,
that is a problem?
Yes, exactly.
Okay. Are there any specific risks associated with insulin pump therapy?
I think perhaps a very slight increased risk of diabetic ketoacidosis. What we have to remember that it's all rapid-acting insulin that's being pumped through the insulin pump. Patients do not have the security of having background insulin, long-acting background insulin in their bodies. That's why it's so important that patients continue to monitor their blood sugar levels. If they're unwell or if their blood sugar levels rise above 14, it's very important that they monitor their ketone levels. And here in Tayside we do advise that patients use a blood ketone monitoring machine for monitoring ketone levels.
Can I ask you a bit about patient education? What are the specific components of patient education with insulin therapy, and how long does this education take?
Our patient education for insulin pump therapy is done through the multidisciplinary team. So there's diabetologist, diabetes specialist nurse and a specialist dietitian all involved in the education of these patients. The education actually starts prior to the patient being considered for an insulin pump. In 2006, we developed an education programme called the Tayside Insulin Management Programme for people with type 1 diabetes to learn about carbohydrate counting. This is done in a group setting, small groups of 8 to 10 patients coming together, learning about identifying carbohydrates and how to adjust their insulin doses depending on the amount of carbohydrate they're eating. So patients have to be proficient in carbohydrate counting before they're considered for an insulin pump. Obviously, there's the technical aspect of pump therapy. They need to know how to push the buttons, what's involved regarding the insulin pump itself, how the pump works. And for a week prior to the patients actually commencing their pump with insulin, we would do what we call a saline start, where the patient has a practice with the pump, with saline running in the pump, still giving their injections, but it allows the patients to become familiar with the workings of the pump. Your other question about how long does this take? A lot of that really depends on the patient. Some patients pick things up very quickly and can run with things in a matter of days. Mm-hmm. Other patients, things just takes a little bit longer. So our care is very individualised and we work with the patients at their pace.
This all sounds quite complex and needs a lot of organisation. How did you go about setting up an insulin pump service in NHS Tayside?
Well, Debbie, that was actually quite a long process, and that's developed over time. In 2002, the Scottish Diabetes Group formed to take forward the Scottish Diabetes Framework, and part of that framework involved insulin pump therapy. So all our protocols and guidelines have been based on the Scottish Diabetes Framework. So we've been working very much along with the Scottish Diabetes Group regarding this.
And were you able to learn from other people's services elsewhere?
Yes. Prior to actually commencing any patients on pumps, part of the multidisciplinary team have taken part in insulin pump programmes and also structured education programmes. So we have people who have got qualifications in structured education as well as insulin pump therapy.
Sounds good. So what does the pump service in Tayside offer and who's involved in this service?
Again, it's a multidisciplinary team that was involved in the planning of our service. So we've had people from management, diabetologists, specialist nurses, dietitian. The managed clinical network manager played a big part in developing this, as did our clinical lead for diabetes. We had a business plan that looked at the costings for insulin pumps. Currently, we have funding for 12 new insulin pumps a year. We looked at a service plan because this was part of service development, and we had to look at costing for staff as well as equipment. We also had to look at staffing and the resources involved with this, and obviously we have had to audit our service.
Okay, good. And can you give me some idea of how much it costs for a pump and how much it costs for the consumables, the tubing and the sets and the equipment that patient needs in order to work with a pump?
Yes, actually the Scottish Government have recently done a costing for a pump, and that's including staff time, insulin and all the consumables required, and that's £4,600. The warranty on an insulin pump lasts for 4 years, so lasts for 4 years.
So it's £4,600 per 4 years, yes, per patient?
Per patient. As I mentioned earlier, the Tayside Insulin Management Programme, which we certainly advocate anyone who's wanting to have an insulin pump should undertake, the costing for that worked out at £1,500 per course. and that's for 8 to 10 patients.
Is there anything else involved in the pump service?
Yes, we also run insulin pump clinics. We have 2 clinics per month. In attendance is a diabetologist, a diabetes specialist nurse and a specialist dietitian. We have the facilities where patients can download their pump, and analysis of the pump data is available for the patients when they attend these clinics. The other thing that we have set up is we have a protocol for insulin pump therapy, and that actually serves as a care pathway for patients who are requesting an insulin pump. We have a detailed assessment form that we use when patients are requesting an insulin pump, but also for patients who are perhaps transferring from another area in Britain or from paediatric service. We also have a patient partnership form that we ask the patients to sign because we are working alongside them in their care of their diabetes.
Thank you. What other support is available for people with diabetes using insulin pump in terms of information, in terms of technical support?
All insulin pump companies have their own website where patients can access information. NHS Scotland has developed an insulin pump leaflet to give patients basic advice about insulin pump therapy. If you're looking at a one-to-one, we can facilitate a meeting with perhaps someone who's considering a pump, with someone who's been using a pump for some time, to allow them to speak to a pump user and perhaps get a hands-on, as it were, view of insulin pump therapy. We also run evening sessions for people using insulin pumps, more an information and getting to know each other sessions. We run those twice a year. We've also produced an insulin pump workbook, which is an education tool for patients. It covers all aspects of insulin pump therapy, but it's something that the patient can then take away themselves, that they can refer to, use it as a reference guide, as can their relatives and friends. And lastly, the companies have technical support helplines. These helplines are available 24 hours, and if a patient has a technical problem with their pump, they can access that.
Mary, can you just quickly talk me through the pump?
Yes, I have a pump here, Debbie. Let me show you this one. There are certainly many different pumps available on the market. This is one of the pumps that we would use, but the basis of pump therapy is exactly the same. The pump looks like a small pager. It has a reservoir with insulin. The reservoir is attached to a set with tubing, and the set goes into the patient's abdomen, thigh or buttocks. The pump has a facility to set different basal rates, and in theory we could set up to 48 different basal rates. In practice, most people have about 4, 5, 6 different basal rates over 24 hours. So we have a pump that's constantly pumping insulin in, steady trickle all the time. This pump has a facility where the patient can calculate how much insulin they need to take when they're having some carbohydrate food to eat. So it's got a little computer inside it. The patient needs to put in their insulin to carbohydrate ratio, what their blood sugar is, and what their blood sugar targets are, and what their insulin sensitivity is. Insulin sensitivity is how much does 1 unit of insulin adjust someone's blood sugar levels. All this data is in the pump. The patient will then look at the amount of carbohydrate foods on their plate, work out the amount of carbohydrate that they're going to be eating, put this into the pump, and the little computer in the pump will work out how much insulin they will need. The other facility that this pump has is the pump will remember active insulin. Active insulin is insulin from previous boluses or any correctional doses that the patient may have, and that will remember it for the 4 hours previously.
Thank you, Mary. So we've heard about the insulin pump therapy experience in NHS Tayside. There seems to be quite a structured service there. What about insulin pump therapy where you're working? What's your experience? Are there similarities? And I dare say you face some challenges. It would be interesting for you to discuss this further.